بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. Good evening, fellow colleagues and the esteemed viewers. It's an honor and privilege to be here with you today. This webinar is the second of its kind in collaboration with the Oman Medical Specialty Board, and it's the 11th webinar that has been organized by the Omani Public Health Promotion Society during COVID-19 pandemics. The impact of COVID-19 on medical education is unprecedented, far-reaching, and present unique challenges to the medical and nursing universities. Mitigating strategies should be principle-based, forward-looking, and compassionate. Lessons learned from the medical education and nursing education adaptation during the pandemic can be potentially be extrapolated to other crisis situations. Today's webinar or symposium will outline the key lessons that were learned during this pandemic from different schools. We will start today with Dr. Muna bint Ahmed Al-Saadoun, Dean of College of Medicine and Health Science, Sultan Qaboos University. And Dr. Muna, she will elaborate on their experience during COVID-19. Dr. Muna, the floor is yours.
Thank you very much, Dr. Fanna, and extend my thanks to all of the organizers of the webinar. I will share with you today the experience of the College of Medicine and Health Sciences with regard to medical education during the COVID pandemic duration. As all of you know that the college offers 3 undergraduate programs at bachelor degree, Doctor of Medicine, Biomedical Sciences and Health Sciences, 16 postgraduate programs, and a full year of internship training program. All of our teaching activities take place in the college, Sultan Qaboos University Hospital, 5 affiliated hospitals, namely the Royal Hospital, Khawla Hospital, Al-Nahda Hospital, Al-Masarra Hospital, and Armed Force Hospital, with 10 health centers. And for the internship training program, there are also some regional hospitals which are contributing to the training of the interns. Now, during the suspension of teaching, which was on 15th March 2020, all of the teaching activities in the college was stopped, and in the health institutions, and definitely the elective program also was suspended. By 18th of March, all of our students were back to Oman from their international training, and all of the international students who are in Oman, within 2 weeks of the suspension, also they returned back to their countries. At that moment, the university at all of the colleges level decided that they will go for emergency remote teaching. And I will be sharing only the experience of the College of Medicine and Health Sciences. So within the college, this decision was taken on board by the examinations and the curriculum committees, the medical education department, and we formulated a new committee, which is called the Emergency Remote Teaching Committee. These 3 entities try their best so that they will come up with strategies with different scenarios that address the teaching for all of the programs that we are providing in the college. And following putting these scenarios, all of these were shared with all of the departments at the level of the college board. And a lot of collaboration and preparation was done with different units within the university to look at the administrative, and definitely the students were involved and informed of this plan at certain stage so that we can agree with them on the final strategy of addressing the online teaching. For the implementation, which started on April 12, 2020, Moodle was used as the platform for the online teaching, and we used Zoom and Big Blue button for the interactive sessions. And this was, I will summarize first the preclinical part of the programs. So we have adopted the original semester timetable, and we use synchronous and asynchronous modality of online teaching. The communication with the student to coordinate the teaching was done through these different social medias and emails. And the outcome of all of the efforts from everyone resulted in completing the 8 weeks of the spring semester. The summer semester was offered fully online. And on 13th of September 2020, we started the fall semester in the college. Now, with regard to the phase 3, which is the clinical phase of the MD program, the curriculum committee revised all of the courses and the rotations with the help of the coordinators of the rotations in the affiliated hospital and in SQH. And all of the theory-based sessions were produced in electronic format, and simultaneous interactive sessions were also organized for the student. And all of the educational material was recorded and posted on Moodle for further access by the student at any point. Now, the outcome of this resulted in delivering the remaining teaching for the pre-internship students. And we managed to complete 12 to 18 weeks of the rotations curriculum contents to the junior clerkship and the senior clerkship students. This is just a table that summarizes the amount of online teaching activities that happened only during the remaining 8 weeks of the spring semester. More than around 800 online teaching sessions were delivered during these 8 weeks. Now, with regard to the assessment, the examinations committee in the college decided that for all of the preclinical semesters and some of the postgraduate courses, online, synchronous, and asynchronous exam were adopted. For the final MD exam student, a face-to-face exam was organized, taking all of the protective measure in July 2020. However, for phase 3 exams, which are work-based evaluation, it was decided that all of the assessment will be postponed until the students are back to the health institution for clinical training and assessment. Now, we started at some stage that blended stage of teaching is required for the safety of the patients and the student and the staff. Online will be adopted for some part of the teaching, but definitely to assure that the clinical competencies are delivered to the student, we will need also some face-to-face interaction with the student at phase 3. And this is what happened, and a clear plan was put, and the final year of the BMS students, who were 12, managed to finish their clinical placement in the laboratory of Sultan Qaboos University Hospital, and they graduated. In 23rd of August, we started the clinical teaching in the health institution, affiliated hospital, and in SQH for pre-internship students and 120 senior clerkship students. And in 30th of August, we started the junior clerkship student clinical rotations, and 132 students are already joined, and they are doing their clinical teaching. And in the same week, also, we started the pre-clerkship student, 114, but to reduce the crowding of students in the health institution, the pre-clerkship student, it was decided that they will have 4 phases of teaching with online, followed by face-to-face teaching, and then back to online teaching until they finish their exam. And now the curriculum committee is working on the outline of what will be the junior clerkship rotation after they pass their preclinical exams. This is in general where we are now. But definitely I will share with you some of the challenges. This is just part of the challenges that I have listed, but there are many challenges, and I'm sure my colleagues will also touch in some of these challenges. Now, for the students, anxiety, fear of the emergency remote teaching was noticed. The accepting the idea itself, worried about the quality of the teaching, internet problem that might affect their teaching or performance in the exam, and definitely having assessment for some of the courses that they have been used for face-to-face exam was a challenge for them. And we are sure all of us are worried, especially in the first few months of the pandemic, about the well-being of the students, well-being of their families, and the country in general. With clinical teaching, we share the student with the responsibility of their safety, and the safety of their colleagues and the patient. And this is, we are sure that it is a burden in the student, but it was part of the maturation that they need to go through during this critical time and crisis. The protection measures that have been taken did affect the teaching mood and modified a lot of the session, and definitely this will be a challenge for all of us, the students and the staff. And generally, the limitation in the socialization, the absence of the extracurricular activities, restrictions in the accommodation because of the regulations that have been put for the control of the spread of the infection, and all of the services provided to this student, the academic services, are online, and this definitely will also have some load in the students, such as the registration, add and drop, and appeal. With the staff, the change of mindset, so that the idea of shifting suddenly from face-to-face teaching to online teaching and assessment could have some stress factor on some of the staff. Everybody was stressed, worried about their families, the restriction of travel, not being able to take their leave, and restriction of activities. The available time for the course coordinators and the tutors to modify their educational material to electronic format was really short for everyone, but we had to manage with that short time. And added to it is the nature of some of the courses, which by definition, it is sometimes difficult to change it into remote teaching, such as the lab-oriented courses. The complexity of the multidisciplinary courses that we have in the college. Some of the courses are taught and evaluated by around 20 tutors. And this will add an extra load and delay in taking decision with regard to the teaching modality and the assessment. And this was also reflected in delay in giving some information to the student, and this definitely have raised the stress in everyone. The clinical service demands for those who are involved in clinical service within the college and the hospital is also a stress factor for them. With the college, working remotely and the impact of this on the communication and distribution of work, providing the safe environment within the college and the protective measures were also challenging in the beginning. Dealing with the staff who are infected and the contact tracing and controlling the socialization was also at some stages a problem. The amount of meetings that the staff had to attend for the strategy of the online teaching, coming up with the opinions and discussing the different scenarios, attending webinars so that we will increase our knowledge with regard to the experiences from other institutions was also a load in everyone. And definitely adjustment to the changes that happen in the guidelines and the academic regulations added an extra factor of stress for everyone who are working in the college. There have been some also peculiar challenges specifically to the clinical teaching. Availability of patients, for example, for the teachings, and this was more in some of the specialties, missing or modified some clinical activities such as morning meeting, which have been stopped, and the teaching rounds which have been modified. The arrangements for students requiring quarantine after starting the clinical teaching also is a challenge, and it needs a lot of close monitoring and contact with the students. So this is mainly the challenges, and we have taken, I will focus only on the measures that have been taken on the clinical teaching. The arrangement for the clinical teaching, the discussion of which started from May 2020, and it was a joint decision that involved the college, the affiliated hospital, and Sultan Qaboos University Hospital, starting from the general directors of the hospitals, and reaching up to the coordinators and the tutors themselves. So it was a lot of meetings until we came up with the final decision on how the teaching will be conducted. We had in between a lot of activities with the student to raise their awareness, specifically with the protective measures. There have been a lot of open meetings, return to the college guidelines that we have developed, and it was distributed in a good time for the students so that they will know what they should do, what they should avoid. And there was availability of videotapes on protective measures that they have to adhere to. One of them was produced by SQH, Infectious Control Department, and we used also the WHO videos. The arrangement of accommodation, transportation, all of it have been changed so that we will try our best to ensure that there is adequate physical distancing and also minimize the mixing between the students. And we created a focal group for all of the for each cohort of students that they will contact whenever there is red flags or signs of infection, so that there will be early detection of infection and fast and appropriate response to such risk. The curriculum committee did a huge job by revising all of the courses in phase 3, the contents, readjusting of the degree plan based on the amount of teaching that was delivered during the remote teaching period, rearrangement of the teaching methods with peculiarity of some of the specialities that could not take students, such as ICU, for example, with telemedicine introduced for some of the subspecialties, and restructuring the teaching group so that we will have smaller number of students attached to specific units and consultants to minimize mixing and reduce the contact tracing in case if there was positive cases. Now, this is in general what has happened. Where we are now at this point, we have a preclinical, BMS, and the intercalated students who are progressing in their degree plan. There was no delay in their degree plan, and the course coordinator are addressing the required skills to be revisited after joining back to the college. The clinical students, they are back to the health institutions, progressing also in their degree plan. We are currently 6 weeks delayed, but we hope that it will not be more than 6 weeks, with the possibility of shrinking this number of weeks delayed. The final year student, they graduated, they were 3 weeks delayed, and they managed to join the internship program in August 2020 as planned in the degree plan. The internship program is continuing its training, it was never stopped, and the internship committee is doing the required and the appropriate adjustments for all challenges they are facing throughout the training. The postgraduate student, we had few students who had to postpone or do a request an extension, especially those who have lab-based research, and during the lockdown, they couldn't come to the college, and some of them will be delayed, but it will not be more than 1 semester delay, and all of them are back in their research activities. So in summary, fast-track evaluation of circumstances is very important. And the aim of such evaluation is to come up with the appropriate decision for the situation at that time. And for the College of Medicine, the decision that was reached by the curriculum committee, examination committee, and the college administration is to assure that there is continuous progression of students and graduation of competent doctors and biomedical scientists. And this was the target that we were looking for. And all of the preparation and activities were done so that we can achieve this objective, and collaboration definitely did facilitate better outcome, and the proper communication is a key for cooperation and compliance with sudden changes and new arrangement. And we have learned this especially with the student. In the beginning, we were communicating through very limited channels of communication, and there was some miscommunication, and following that, it started to become communicating with all of the students, either by a statement that is sent by email to everyone or virtual meeting with all of the cohorts. Teamwork, distribution of the task, sharing ideas and opinions is one of the golden things that can be done so that we will come up with a proper and strategy which will fit and is feasible for the college with the available resources. And the era of COVID-19 and the virtual meetings, virtual webinars did give all of us the chance to share knowledge, experiences, and best practices, either locally, at regional level, and international level. And this definitely enriched our experience, and we managed to adopt and adapt what we have seen from the experiences of other medical schools with the current resources that we have in the College of Medicine. What we are planning next is evaluation of the educational experience, evaluation of the administrative experience, taking of all of these two experiences, what could be continuous, what we can continue in the future. And currently we are preparing to return to the normal life. The plan will be ready as pre-COVID-19 situation, but definitely with improvement and adopting some of the skills that we have learned, all of us, during the last 9 months, and I hope it will not be longer duration. Definitely there have been a lot of people who have been contributing to this exercise from March until now, but we are really counting on our students, their abilities to overcome with us all of the hurdles. And the last 1 month was really reassuring for us that the students are able to cope and adapt, and the clinical teaching is running smoothly, and we hope that we will not have to stop it at a stage and they will be able to progress. I'm sharing with you some of the outcome of the student that they have produced to participate with the community. They produce it either during their quarantine phase or as the student activities. Thank you very much.
Thank you very much, Dr. Muna Ahmed Al-Sadoun, Dean of College of Medicine and Health Science University, Sultan Qaboos University, for your time and well-made presentation. Dr. Muna, you have properly showed the hardship that comes with COVID-19 pandemics and the challenges that was taken by your respected college, and this challenge, how it was tackled by you and your team. Thank you, Dr. Muna. The floor now will be with Dr. or Professor Mohammed Al-Shafi'i. Professor Mohammed is the Dean of College of Medicine and Health Science, National University of Science and Technology. Professor Mohammed also is a member of Board of Trustees, Oman Medical Specialty Board. Professor Mohammed will present for us their experience to outcome these challenges that faced by the medical college in his university. Dr. Mohammed. Dr. Mohammed.
Okay, thank you very much, Dr. Fanna. Can you hear me? Can you hear me, Dr. Fanna?
Yes, Dr. Mohammed, it's very clear and I could see your presentation. Please start.
Okay. Thank you very much. I'm honored to share our experience at the College of Medicine and Health Sciences, National University of Science and Technology. I will touch on the challenges we faced at the College of Medicine, and then how we addressed these challenges and what we learned from this pandemic, COVID-19. 3 phases of our journey: pre-lockdown, then during the lockdown, then the new academic year 2020-2021. So pre-lockdown phase, the change was very imminent due to increasing number of cases being reported in Oman. And we have taken the following steps. During this period, 1 week before the lockdown, teaching shifted completely to the college campus. Students withdrawn from different hospitals and polyclinics and health centers. How much at this time we completed of our curriculum? In the pre-medical and pre-clinical phases, about 60 to 70% of the curriculum was completed. And in fact, some of the courses already completed by this time, some of the courses. In the clinical years, especially the final year, 4 rotations out of 6 were completed. So that about 60% of the rotations of the clinical years have been completed before the lockdown. So the government, this is now we will talk about the lockdown phase. The government announced the lockdown. Emergency faculty meeting was held on 14th of March at 6 p.m. on Saturday at the college campus to keep the program running without break, to ensure students do not face any major setbacks or delays. And this was really an opportunity for us for innovation. So the preparation for this lockdown phase, we had very short time to prepare, only 1 week, work at war footing at 3 levels, educational technology, to try to find a suitable educational technology platforms, and also curriculum revisit. We have to revise our curriculum and teaching methods to fit to online teaching, and also at administration level to provide the necessary and required resources. Challenges for faculty. Faculty used to face-to-face teaching, and they were very new to remote teaching, especially in medicine. Some faculty had fears of using technology, educational technology, technophobia, and also some have difficulty in engaging students remotely. This is a new experience for them. Stress and mental health could not be avoided because it is, especially among students and also faculty. Conducting assessment was a challenge to us. Challenges for students: extended screen time, lack of peer interaction, internet connectivity, and this is the major challenge for the students. Stress and mental health was also a challenge. Academic worries. Are they going to study what they're supposed to study in the remaining period? Are they going to pass these courses? So there are a lot of questions and a lot of academic worries amongst the students. Overcoming difficulties related to educational technology. We have taken the following steps. Maximizing the use of SOL. SOL is our learning management system from West Virginia University, our partner. And this is really very useful learning management system. We use it before for all our assessments and exams, online exams, and also for our teaching materials and other things. Also, we negotiated with Omantel to get free of charge access to our students to use SOL without charge. Obtaining license for excellent teaching platforms like GoToWebinar and Cisco WebEx. And we are very lucky to get license for teaching platform like Webinar and Cisco WebEx. And it was really free of charge because all these companies or organizations try to help and provide support to medical education. And we tried within 1 week to get a webinar in place. Enhancing e-resources at the medical library, and we got many resources at the medical library level to help our students and faculty dealing with this situation. We provided clear policies to guide faculty and students, and also providing support to both faculty and students for their psychological well-being. Overcoming difficulties with practical training. So all this is lockdown and all students at their homes, and it was difficult to bring them back. So we use virtual labs for preclinical students, and for clinical students we use virtual patients and simulated patients via webinar and WebEx platforms. Overcoming general difficulties faced by students, online teaching committee was formed, and this committee consisted of senior faculty with interest in educational technology, student representatives, head of library services, and head of IT department. So there were weekly meetings offering real-time solutions to students and faculty. Students members shared their experiences and expressed their concerns, and their opinion was shared and acted upon. Overcoming general difficulties faced by students, student feedback and communication. Google Form feedback was formed at different intervals of this period of lockdown. The first one was just satisfactory, but the later feedbacks showed that the very high rates of evaluation, and the students really were very satisfied with the online teaching and what we are giving them during this period. Communications from the dean, HODs, course coordinators to students was continuous, and this is to reassure the students and to guide them, and it was continued through the period of the lockdown. Student representatives on the online teaching committee also, they expressed their opinion, and I said it before, and they also, this is type of communication, and to listen to them and to their problems, and their problem being resolved day by day. And also we offer to them 24/7 IT support. They can call at any time to the IT personnel, and they will help them at any time of the day or night. Student counselors always available, open access or by frequent calls, and about 100 counseling sessions have been done during this period. And really, this has very good and positive impact on our students to overcome this very difficult period. Faculty advisor system kept active. All faculty maintained contact with their advisees, and we are checking every week with our faculty if they are following their students or not. What we have done for faculty, overcoming difficulties faced by faculty. We had weekly online resource training hub. We call it, this is very particular for our college, WARF, aimed at faculty development, differentiately skilled faculty to share their expertise with their colleagues in the college. This is at the college level. We have external resource persons from different countries, from United States, from Canada, from Germany, from India, and from the neighboring countries. They are really, we benefited a lot from experiences of others during this period. Also, we presented our experience to WHO and UNESCO in a common meeting between us and them, organized by the WHO office in Muscat on our request. And they were really happy about our experience and what we have done during this period. Examples of some sessions infusing interaction into the sessions: use of whiteboard or writing pads, recording sessions on learning management system, video editing by faculty, video, voice and video recording, and also there are many sessions about anxiety, how to cope with anxiety and stress during this period. We try to support our faculty because they really face a very difficult time. The challenge of assessment. You know, as I said, we finished about 60 to 65 of our curriculum at that time of lockdown. And also, many of the assessment, midterm exam, block exam being completed before the lockdown. So about, you can say, 60 to 70% of the preclinical assessments being completed before the lockdown. And what is remaining, some small exams and the final exam. Final exam usually in our college between 35 to 40%. And this is as instructed by Minister of Higher Education, converted into assignments for the student in the preclinical phase. And this is really lead to little inflation in our grades of students. But for the clinical years, what we have done, we have readjusted their marks in the 4 rotation before the lockdown, and we use the end of rotation exams because our end of rotation exam attended by external examiners, and we have written part, we have OSCE part, and we have clinical part. So the rotations completed before the lockdown, their marks and their grades depend on what they have done in the end of rotation, and we canceled the clinical exam, the final clinical exam, and we readjusted the marks. Also, there are 2 rotations. We used online theory exams as we planned, and also we introduced a new modality, which is oral exam instead of OSCE exam for the remaining 2 clinical rotations. So we have done online theory exam and plus oral exam replacing the clinical component. And this was through webinar and Cisco WebEx, where you can see and you can talk to the student. Faculty can examine and talk to the student face by face through these platforms. When we converting some assignments to assessments to assignments, also we were very careful in this. You know, we're trying to use different types of questions to keep the standard of students at higher level. And the following platforms being used, like Sol, Google Meet, and email, they were used for assignments and for online exams. GoToWebinar and Cisco WebEx, they're being used for Viva and for more clinical questions and more clinical assessments. The new academic year, and this is the last phase, planned sequencing, phase 1 from September to December, and phase 2 from January onward. Why we have divided this in 2 phases? Because we thought maybe in this period will be difficult period from September to December, and then we're hoping for new vaccines or change in the situation of COVID-19. The vaccine might resolve the issue. So based on that, we plan to divide the year into 2 phases. So like clinical students, they will have 3 weeks of medicine rotation in the first phase and 3 weeks in the later phase. So all students will get equal exposure to patients later on. We know that, as Dr. Muna said, the contact of patients now in the hospital is the number of patients really very, very low. The volume of patients in the hospital very low. So we are trying to we divided these 2 phases, then the student will get more exposure later on. So phase 1 highlights MD1 to MD4, and these are the preclinical, pre-medical, and preclinical phases. This will be online teaching from September to December. This is completely online teaching. Subjects that are most amenable to online teaching will be covered first. Subjects requiring more practical would be done in the second phase. Also in phase 1 for MD5 and MD6, these are the clinical years, we started blended teaching and learning. So according to the rules and regulations from Ministry of Higher Education, September will be completely online, and the clinical or blended learning will start in October. And as you know, there is good percentage of our students are international students, and because of the flights, they are not able to join and to come to Oman, and they will take time until we get permission for them from Ministry of Foreign Affairs. So that will take some time, and we will start their clinical, inshallah, in October on their arrival, and after they completed the quarantine. So we have, for the clinical years, we have clinical training, small groups, as also our colleagues done in SQU and over the world globally. We divided the students in very small groups. So The student will learn in the hospital in small groups and in very short time in the hospital. And also they will learn in the skill labs and on simulation. And the other thing will be online teaching using different modalities to teach certain clinical skills and patient care. So Cisco WebEx, which I talked about, it has many features like live lectures by faculty with video and audio using PowerPoint slides and other materials by screen sharing, virtual classroom, group discussions and clinical case discussions among students and faculty, presentation by student, by host presenter sharing, teaching by screen sharing, medical or clinical, videos from YouTube or faculty made videos, teaching by screen sharing, online textbook or other related materials. So that really these teaching platforms are very useful to us. Also, this is example of the things we're trying to purchase to support our student. Physio X, laboratory simulation in physiology, and it has 12 exercises with more than 60 easy to use laboratory simulation activities that complement or replace with labs. This is very useful, and this will help our students in physiology learning. So phase 2, normalcy restored. If normalcy restored, then it will be normal routine. Face-to-face learning, we can start. Partial normalcy, continue as in phase 1, maybe blended teaching, preclinical years. But we hope to go to normalcy, to normal, inshallah, after January. I hope, we are looking forward for the vaccination. Opportunities, what we learn from this, I think we have to think in our educational strategies about blended learning and educational technology, which is very important for medical education, and we learned a lot during this period. And I think blended learning for future, this is one of the strategies for future, which is very important. I think COVID-19 has a lot of problems, but also we learned a lot from this pandemic, especially in medical education. Thank you very much. Dr. Fanna?
I think Dr. Fanna is disconnected.
She will come back.
Maybe I should go ahead with the next presentation.
Continue your session, yeah?
Bashir, we can maybe go ahead with the presentation, please.
Dr. Fanna?
So perhaps while waiting for Dr. Fanna to come back, I'll start my part.
Yeah, Dr. Siham.
Yes, go ahead, Fanna.
Dr. Mohammed, thank you very much for your rich, informative presentation. I'm sure all the viewers learned a lot from your presentation. So now I will give the chance to Dr. Siham bin Salim Al-Sinani. Dr. Siham is the Vice President for Professional Competence Affairs, Oman Medical Specialty Board. Dr. Siham also a Senior Consultant, Pediatric Gastroenterology, Hepatology and Nutrition. So Dr. Siham will talk also about the challenges that was faced by the Oman Medical Specialty Board, but for the postgraduate, and all the opportunities that were taken from this experience in order to enhance the postgraduate education. Dr. Siham, the floor is yours and it's open.
Okay, thank you, Dr. Fanna. I really appreciate this opportunity to work with my colleague panelists and maybe perhaps contributing a little bit to the medical education during the COVID-19. What I wanted to say is that I actually labeled the presentation as boon or bane. So if it is something good that is happening or something that is not very good. So to start with, we all know that competent physicians are not born, they're made. And we're really sending our sincere gratitude to all the first-line workers in medical education, of course, in addition to everyone who is out there in the different sectors, who are utilizing well-thought-of systems to attain educational milestones. Can we go to, thank you, Bashir. As we're aware that the changing pace in medical education has been steady but very slow in the past years throughout the world. And that is primarily because of the constrained support by the legacy of having traditional practice and maybe resistance to change. With COVID-19, of course, pandemic, as previously mentioned, there was abrupt disruption in medical education, which also altered the landscape of medical education throughout the world, where teaching hospitals are encountering a rapid expansion of one illness, which also, of course, showed some restriction of the planned clinical learning experiences in medical education. During this pandemic, OMSB ensured a steady stream of competent physicians production amid the pandemic, and with the foundational consideration of having the safety and well-being of learners in the context of providing safe patient care. This is a global crisis. We're not alone, we're not different. However, there are different adoption strategies throughout the world in different training organizations, but perhaps we all have common themes to share. So going from there, I wanted to talk a little bit about what have we faced during the pandemic in the postgraduate medical education. We were faced with concerns about safety and well-being of learners, be it the local learners here in Oman or the trainees that were sent abroad for different rotations or for fellowship programs or residency programs. We were also concerned about the safety and wellness of the faculty and OMSB staff. We were also faced with the, can you go back please, Bashir, to the previous slide? Thank you. We were also faced with the suspension of various academic activities that involved physical gathering or even traveling, which also resulted in interruption of planned training. Next, please. We also have faced a decrease of certain clinical load related primarily to the suspension of elective surgeries and clinics, outpatient clinics. But we were also concerned about perhaps increasing the clinical demand of possible workload related to areas that are dealing primarily with COVID-19 patients. That created also concerns about the quality of supervision and assessment. We had commitments of scheduled international and local accreditation site visits. And there were also concerns about meeting the standards of such accreditation. And we had to overcome the challenges that were facing the continuous professional development activities since they were stopped. So moving from the challenges that were facing the postgraduate medical education, here I move to the measures taken by OMSB. And OMSB has taken many necessary measures adhering to the instructions, of course, from the Supreme Committee. However, OMSB exerted all possible efforts to preserve quality education, ensuring the safety and well-being of OMSB trainees as well as the faculty and staff. With that, OMSB ensured that all trainees adhere to the precautionary measures to ensure, of course, their safety and safety of patients. And we made sure and very clear, and we communicated that to the faculty and as well to the trainees, that trainees should not be penalized for any uncontrolled or unexpected negative impact on training and or that were happening to the system. Just to talk about the measures taken also by OMSB, we will not forget the contribution of the trainees. Trainees in OMSB continue to provide patient care in various hospitals and various training sites. They supported healthcare system, they provided voluntary e-consultations, and they also contributed in COVID screening campaigns. We will also not forget the faculty contribution to this. They've launched and they actually created and launched online courses in very, very short time. I think we're talking now about back in March 2020. To deal with such challenges, OMSB ensured effective multimodal communication and very effective and consistent messaging with all the stakeholders, with early engagement of the stakeholders. We also adjusted curriculum and rotation schedule and assessment tools as well during the past period. There were certain trainees who were removed temporarily from certain training sites and direct patient care. There was suspension of all the in-person academic activities. However, there was immediate implementation of online learning to mitigate the suspension of in-person academic activities. We also created a system to report the possible trainees being either infected or exposed to the infection and were in quarantine. And we limited the movement of trainees between participating sites so that we prevent transmission of the disease between the different healthcare facilities. We also made sure that issues related to high-risk trainees were addressed promptly, and we also ensured the implementation of duty hour policy to prevent overload of work on trainees. With that, there has to be a little bit of rescheduling of certain rotations based on the clinical and educational needs. And with that rescheduling, we had also to make possible compensation for any educational and training gaps and requirements in training that might have occurred. We made sure and insisted on having maintenance of supervision to all the training residents according to their level. And OMSB also made sure that provision of psychosocial and well-being support of trainees was available and easy for access. For international trainees, we made sure that there was swift and direct communication with the trainees and universities abroad, as well as collaboration with authorities, whether local or international, to ensure safe return of some trainees to Oman when necessary. And so moving from the challenges that we faced, I would like now to talk about medical education in Oman amid COVID-19 and what is going to happen beyond that. And to address that, I actually had few questions. If Shiri can go back to the previous slide, please. I had several questions to address, perhaps more than answers that we have right now. And we wanted to really now think about what we have to do and what can we propose to overcome this current crisis and perhaps prevent further disruption in education with the possible future crisis. Some more questions that we're considering and I keep thinking about is, will current plans suffice the management of possible future crises? And what do we need to meet the so-called next new normal? And what have we prepared for this transitioning? I can say that it is really time of so much uncertainty. There is disruption that has already taken place in whether learning or assessment or even preference of faculty and trainees. We're aware that the next new normal for medical education is just around the corner or maybe is happening. Therefore, I think it's better that the pandemic is viewed as a catalyst for transformation of medical education. And this quote applies to pretty much everything, but I think we really need to consider it for medical education, not to let a crisis go to waste. And we should use all the opportunities that come out of such crises. The first thing we would have to think about is that initiation of a disaster management plan in medical education is essential to navigate the possible crisis and ensure continuity of education without disruption. We have to be conscious of the next normal in medical education, as I previously mentioned, and perhaps looking into reforming the medical education system into a system that is blended, learner-centric, compassionate, digitally enriched, and competent and need-based. We need to think about investing in what we call education continuity planning to restore a state of education as normal, if we can say so. And that can happen by building learning and plan ahead teams. To do that, we need to find local solutions. We all standard one-size-fits-all solution. With that, a sense of urgency has to be there. We cannot wait weeks or months to think about what will happen. The medical
دكتورة سهام.
دكتور سهام.
بشير. الأخ بشير.
مرحبا دكتورة. شكرا.
يمكن الشبكة مع الدكتورة. دكتورة سهام. تفضلي دكتورة. بشير، أنا الصوت مش واضح معايا.
الصوت يتقطع مع الدكتورة سهام. الدكتورة سهام بس الإنترنت شكله شوية انقطع معك.
طيب, do you hear me now?
الحين.
أيوة, yes please. Go ahead.
And so to do this, we really need to think about the balance between the knowledge that we provide to learners and the skills and the competencies, but also what the community requires and needs at this stage and possibly future stages. And with that, we need to create combination of accessible and available educational tools and revert to digital transformation, not only for provision of medical education, but also for monitoring and for assessment. We also need to consider closing or minimizing the gaps in the trainers and the educators' development and skills to be able to meet the next normal, as well as closing the gaps in regulations and legislations And we should really resort or resolve to the technical education decisions rather than what has been already existing. Before I finish, I would want to reiterate that we need to address the gaps in lifelong learning for health professionals, ensure political and social commitment. We need to optimize the curricula to meet the current needs of healthcare, as well as the clinical learning environments to meet the new requirements, and stay sustainable to reimagine the future that expedites the digital transformation. And I just want to remind all that we shouldn't let a crisis go to waste, and we should utilize it really to the full to benefit from this huge opportunity for change and development and improvement of medical education in Oman. Thank you very much.
Thank you very much, Dr. Siham, for your well-made presentation. I totally agree with you. We need not to let this crisis to go to waste. Now we will give the chance to Dr. Warda Al-Amri. Dr. Warda is from the Faculty of Nursing at Oman College of Health Science. Dr. Warda, she has 15 years experiences of teaching at Faculty of Nursing, and she is the National Pre-Service IMCI teaching at the Ministry of Health. Dr. Warda, the floor is yours.
Thank you so much. Hi, everybody. Good evening. I know I'm the last person, but I hope that we save the best for last. But I wanted to thank all my colleagues for such wonderful presentations they have done so far. It's very informative, and I think our experiences with the nursing challenges, nursing education challenges, and the medical education challenges are very similar. First thing I want to do also is to extend my appreciation for OMSB and Public Health Society for inviting me to share our experience. And I will try, because I know the time is very limited, I'll try to go very fast on the few points. And I'm sure that all of you will understand from the previous sessions that my colleagues have provided, and our educational challenges in the nursing field, it's almost similar. So let me just share my. I'm trying to share my screen. So I will go just very briefly on this, because we have this transformation in our nursing education from a very familiar and common to students and to the faculty in a face-to-face environment, comfortable for the student, comfortable for the faculty. With the COVID-19 pandemic crisis, we had to channel all our efforts, just like our educational institutions colleagues, that they have done into an e-learning environment. And that was not an easy task, but I consider ourselves that we were up to the challenge, and we have done our maximum efforts for the last academic year, and we are working towards even maximizing our potentials for this academic year. And I have to say that, as we have seen from the different education institutions, that the implementation of the strategies varies accordingly to the different institutions. This would have been an extensive 8 minutes talk on the different challenges that we have faced, but I'm sorry, I'll just go back to one slide that I wanted to acknowledge my colleagues from the nursing field in University of Nizwa, Leah, and from University of Brahmi, Virginia Vargas, and from Sultan Qaboos University, Lina Shakman. I wanted to thank their contribution, because they are members of the pre-service IMCI, and they have shared what challenges also they face. So if I go to this slide, most of the challenges we face challenges that are basically focusing on 3 areas. These 3 areas are related to the system itself, and to the faculty and to the students. Now, as you can see, there are, as I said, there are common challenges that also in the medical educational field they also face. So, for example, as a teacher, you have to work on instructional design and redesigning. Last semester, it was in the middle of the crisis, we had to reform the way of teaching methodology we're going to use. We had to accommodate to different teaching and learning styles of the students and also the faculty, because as Dr. Mohammed mentioned, not all the faculty are technologically updated on using e-learning. So that was a challenge for us. Theory versus laboratory, this was a challenge for us, and because as the medical field also, they had the same challenge on having the students going into the clinical settings and practicing on real patients, giving care. So that was challenging for us. We in Ministry of Health institution, which is the Oman College of Health Sciences, we had the opportunity of giving online courses for the practicum, and also we had very strict preventive measures and preparatory precaution measures in which we did our final clinical exams on our site, which is the college, using our laboratories, by minimizing each lab to have one student only, and we conducted those examinations. So we had videos, we had students being practicing, and then we had the students coming for their lab OSCEs and their lab final clinical exams. For one of the major common challenge across the specialties was the IT support. So our students also expressed concerns with having disconnected from the internet. They are not able to log into the sessions. So we also have tried to help in that area by providing pre-recorded PowerPoint slides in which the students can have see the faculty teaching the material. Also, we had to do our reforming our instructional designs. So one of the challenges also faced with teaching and students being in their home and the connectivity. So the environment, for example, not everyone have a clear appropriate room, because visually the students have to be comfortable with the interaction with the faculty when they are teaching. So the environment crosswise from the student and from the faculty have to be appropriate and conducive to conduct these sessions. So for example, noise, lighting, for example, the background, some students had children around. So having the students do, again, when we talk about synchronized and asynchronized sessions and live sessions versus recorded sessions, this could be a little bit of a challenge, but it has to be thought through. So, for example, teaching methodologies also had to be changed, and this was also a bit of a challenge. When we look at also the assessment methodologies, in which we have summative, formative assessments, and then we had final exams. Now we had to restructure the assessment to meet our learning objectives. And we are looking forward to even improve that, in which we had assignments, we had case studies that the students were able to answer. We had the Viva examination when the students came for the clinical exam. But also we have to look into a more, we have to look at more constructive assessment that can go well with the e-learning process. Also, I think one of the thing probably maybe my colleagues haven't or like slightly have highlighted is the within the session engagement, the within the session or the within the session challenge, because the attention span of the students varies, and even with research, they did a research and they found that some of the students, their attention span is only 5 minutes into the session and they lose their attention. There is a continuum in which as a faculty you have to look into how do you engage your students during the session, And the best thing to do is to look as a faculty is to work on the proximal zone of development, because one of the psychologists, Sovietian psychologist, Vygotsky, he talked about the attention span of an individual and whether it is related to the type of material or type of learning. So he said the harder the material, the attention of the student will wander, and this easiest, like the material, if it's easy as well, the student's attention will wander. So as a faculty, you have to be able to maintain that equilibrium in the middle, okay, to engage the student into an interactive session. And that would be also affected by another thing is the size of the class. So when we look at the continuum, some classes have 15 students versus other classes which might extend to 150 students. So that also have to be considered when you are actually planning the educational sessions. Very important to maintain the student engagement. And so the other thing here, which also we had an issue with, as I said, was the laboratory skills and the clinical practicum. And we tried our best with the infrastructure and the resources we had. And this is another challenge, but one of the ways in which also Dr. Mohammed have mentioned was using e-simulations, virtual learning, virtual patients, and that requires the IT support and the infrastructure of the health institution. So to do all of that, to achieve better outcome for your teaching experiences, it all relates on a better planning and better preparation of both the students and the faculty. So what we have also tried to do, we have given faculty sessions and discussed with them on what challenges they face, how can we work on them. We give classes on how to use Google Classrooms. We give classes on how to use and prepare videotaped or audio taped recorded PowerPoint presentations so that they can engage the students more. The learning management system that we also have used was, we had Moodle, we had GoToMeeting, Zoom meetings, Microsoft Teams, and these were again, they require the infrastructure to be built, in which some of these they have to have licensure, and some of them are free, some of them which are free, they have a limited number per class, so that could be was also challenging. In terms of assessment, as I said, we also have worked on changing the modality of assessing, but we had worksheets, we had critical thinking scenarios, assignments, and quizzes. And I think this is an area where we can also build towards the future of nursing education, especially that, for example, Oman College of Health Sciences, we have different branches all over the country, and we need to maintain that standardization of assessment in terms of the infrastructure and availability of resources. So, for example, in terms of test generation, that would help the faculty. We also, I'm offering two of these in which they can also review for preparing the test questions. So this is important because we want to maintain the evaluation and assessing whether the students have achieved the cognitive skills required, okay, to take care of patients and to provide evidence-based care and quality care. So this brings me to this proposal which I have. When I was thinking about all these challenges that are focusing on the student learning, they look similar to what we call to the socio-ecological model. So the socio-ecological model have a focus in the center, in which here I mean the student is our center, and then there are different factors that are affecting the learning, starting by the students themselves. We have also the faculty, we have the educational system, and also we have other factors that could be related to the community. But when we look at the student, which is the main focus, also the students have some responsibility in the e-learning, though we are trying to prepare the resources, to prepare the experience for the student, but without the students being involved, readiness. We have to also provide support, but we also need the student to be motivated to take accountability of their learning. Because though this e-learning experience might be new to many of the institutions in Oman, the e-learning itself as a model of teaching in colleges is known worldwide, and students are prepared in having more than one course that they take throughout the semester, and they have to do the requirements, prepare, and being engaged and being active learners. Because with e-learning, it's more of an active learning that is focused on the student. So we also have to prepare them that they're going to take that part. So with this, I'm saying that it's time to consider the integration of online education in our curriculum and build its structure and foundation to last even beyond the COVID. So what happens after the COVID? This is an area for us, and I agree with Dr. Siham when she said we have to use the best of it. And I say, when life gives you lemon, make lemonade. But this is an opportunity for us that we can make that lasts and improves and transforms our educational system in Oman. With that being said, thank you. I had to make it so short, but if you have any question, I'm happy to answer. Thank you so much for your attentive listening.
Thank you, Dr. Warda, for this elaborative and rich presentation. And I think with Dr. Warda, we will end up the first section of this webinar, and we will start the second section, which is taking questions and answer them. I think we answered all the questions except one question, which is given by Dr. Amna Al-Fataisi. And it's to Professor Mohammed Al-Shafi'i. So Dr. Mohammed, can you hear me?
Yes.
Okay. So if you can elaborate on your experience with oral exams as a modality to assess clinical students.
Thank you very much, and thanks to Dr. Amna for this question.
Dr. Muhammad, the second part of the question, their reliability, ease of administrations, and student adjustments to them.
Yes.
Dr. Muhammad.
Thank you very much. Thank you very much, Dr. Fanan. Thanks to Dr. Amna for this question. I will start with the last point, reliability. We know the reliability of oral questions or oral exam in general, they are not very reliable. But during this pandemic period, we are pushed to use different modalities. And because we can not examine our student in the wards on short cases, we cannot bring them to the campus to examine them using OSCE. And so there are a lot of, problems when we cannot really bring them and let them face the issue of the infection itself. And we have also international students, and it was difficult to bring them back. I know in SQU they brought them for the written paper, which is some people maybe agree on this, some people not agree on this, because there is a decision from the government for lockdown, and we will, as private university, we cannot bring our students back. So we thought about oral exam, and we're trying to do it in a very good way to make it more reliable by using structured sort of questions and instructed in a standardized format, and structured, having different parts and different marks for each part. So we use three scenarios for each student, three scenarios with two panelists, with two examiners, using three scenarios. But it was really difficult and hectic to prepare so many questions for 120 students. you have to have a bank of oral questions. That was very hectic on the side of our faculty. Plus, one of the drawbacks of this method, if somebody, because of connectivity problem, and sometimes students use this to escape from the exam, especially if the scenario is difficult. So they will say, okay, I have connectivity problem. Again, we have to start from the beginning, we have to change the scenario and to ask about a new scenario. If there is no connectivity or we're reaching the half, again, we have to repeat the same session for the student later on by using new questions. So it was difficult, but I think it was good. We got good experience from this, and it was the only method available for us to use to examine our students clinically by using different scenarios, because WebEx and GoToWebinar will allow you to use, like if you want to show them blood tests or X-rays or ultrasound, for example, or different types of questions. But it is a structured type of oral. So this is what we have done. And yeah, reliability, I don't think myself, because it was there before, even the family medicine exams and the old people, they remember that, but we abolished it in the past. But I think now start coming back, oral exams started coming back to colleges of medicine. That's what only I can say about it.
Thank you very much, Dr. Mohammed, for your reply for this question. And I think this will mark the end of this webinar. Special thanks to His Excellency, Dr. Hilal Al-Sabti, for his support. Really special thanks also for the IT departments at the OMSB, to Ms. Abrar, and all the panelists for their contribution with a very rich presentation today. So inshallah, I think by now we will end this webinar. Thank you very much, Professor Dr. Mohammed, Dr. Muna, and Dr. Siham, and Dr. Warda. Wassalamu alaikum wa rahmatullahi wa barakatuh.